This video will take you through creating a bill to a patient using Quick eBill. This feature can only be used if you have registered your site with patientzone. There is a further video on how to use Quick eBill to bill an insurance company. Please note that all the data shown regarding the clinician and patients are dummy data. From the home page, Quick eBill can either be accessed from the Accounting tab on the left or from the Quick menu on the right. You can also access it directly by clicking on the patient's name after performing a search and then clicking Create Bill, or clicking Create Bill directly from the patient details, which is the method I will use on this occasion. You will see that you can either select the patient or another payor who is already linked to the patient. If you wish to send the bill to another person, click Add Payor and either choose someone from your existing database or else create a new contact. It is easier if you create a payor before creating the bill, so you can skip this step. Another tip is if you wish to bill a company or organization, you add a named person within that organization who will deal with bills. Highlight the person you want to send the bill to and click Quick eBill. And then click Next. The second stage of Quick eBill requires details for where and when the patient was seen. If you wish to input a specific number, enter it here. Otherwise, leave this blank to auto-generate the invoice number. Enter whether the patient saw you as a day case, inpatient or outpatient at one of your registered sites, and then choose the correct one. Below the dotted line are options that do not correspond to a registered site. This is generally used more by therapists, but consultants may also see patients outside their registered sites from time to time. For an inpatient stay, which must always be at one of your registered sites, you will need to log the admission and discharge dates, as well as the reason for discharge, which in most cases will be routine. You must also log who the patient saw. For single specialist sites, there will only be one choice from the drop-down menu. I will use an outpatient appointment for the next step. You will see that as you move through the steps, the information you have added appears as a preview on the right side of the screen. Click Next to move on to the next section when ready, or Previous to go back to the first step. The final stage is to add the services and fees. You will note that the service date has been pre-populated from the information you entered for where and when the patient was seen. This can be amended if, for example, you operated on your patient on the second day of a 3-day inpatient stay, or you wish to bill for multiple sessions. However, please note that the date of treatment cannot be earlier than the date originally set. Click on the Treatment Provided box. You will see a drop-down of options and choose the one you want. If you are not a consultant or if the item you want isn't listed, click Other and a pop-up box will appear. Type in the service you are looking for example, physiotherapy. And search the list. Click on the one you want. I will change this to an initial consultation for a consultant. If you have access to guideline pricing and have inputted the fee for the service chosen, you can click the calculator icon next to the fee box and this will pre-populate the correct charge. If not, you can type the fee into the box. In both instances, click Save Charge. This then puts the service and charge into a box which can be deleted by clicking on the red cross. You can add further charges as required following the same steps. For procedures, you need to choose the option Surgeon's Fee for Surgery or anaesthetist fee for surgery, and then type in the code, or type in a word, or click the top 10 button for the 10 procedures you have used most. Again, either use the calculator icon to set the fee or type the fee into the box. Click on the Save and Send button when the bill is ready to be processed. You will be taken to the patient details screen where the bill will appear at the top of the list. All of the 3 boxes next to the invoice will appear green, signifying that your bill has been submitted. patientzone will send the payor email notification that the bill is ready to be paid, and they just need to click on the link and follow the instructions to pay straight away by credit or debit card. As soon as payment has been made, the payor will receive a further confirmation by email. The person at your site who registered for patientzone will also receive an email to say that the payment has been received. The bill will automatically be marked as paid within your ePractice system within 15 minutes of the payment being taken.